Happy Wednesday, happy hump day, everybody. Happy 20th day of November 2013. Sjogren's syndrome is what we're going to be talking about today. Fasten your seatbelts, because when we really kind of focus in on one particular illness like Sjogren's or type 2 diabetes or Alzheimer's disease or whatever, the more we focus on it, the more we peel it back, the more we look at the actual facts, ma'am, just the facts, we see the MD's point of view start to vaporize like water on a road in Florida in the summer after a rain. Here's what the MDs have to tell us about Sjogren's syndrome. Sand in your eyes and cotton in your mouth? There's a name for what you might be experiencing. Sjogren's syndrome is an autoimmune disease, that most commonly affects the lacrimal and salivary glands. Those are the glands which create moisture for your eyes and mouth, respectively. Sjogren's syndrome causes a reduction in the production of saliva and tears, leading to uncomfortable dryness in the mouth and eyes. There's no known singular cause for Sjogren's syndrome, but researchers who are a million times smarter than you believe that a combination of environmental and genetic factors determines who develops the disease. While there are certain genes that increase a person's risk for Sjogren's, the genes do not act alone. Pulling this right off of the web, let me give you the content so nobody says I'm plagiarizing anybody. This is from the Arthritis Foundation, arthritis.today.org, arthritis.today.org. Now, the MDs will tell you, they know what the symptoms of Sjogren's are, and Sjogren's was named after Dr. Sjogren, who discovered these set of symptoms. You know, people started showing up years and years ago in the 19th century, and they had this peculiar set of symptoms, and Dr. Sjogren said, aha, we have discovered something here. So now I'm going to give you my name on this disease, and now whenever you have the dry mouth and the dry eyes and the pain in the joint, you're going to have the Dr. Sjogren's disease. Are you not do you not feel special? Oh, by the way, I have no idea what causes it. I have no idea how to fix it, but I know what to name it. So this is what happened in early, middle, late, doesn't matter, more or less in the 1800s. Sometimes following through into the 20th century, the early 1900s, disease processes started to be named in rapid rates by the MDs, who were trying to immortalize themselves by tacking their name onto a disease process, right? Now, this is a very interesting thing to talk about. Now, let me read you some more. I'm pulling this off of the Sjogren's Syndrome Foundation. Hold on. The Sjogren's Syndrome Foundation. Sjogren's symptoms frequently overlap or mimic those of other diseases, including lupus, rheumatoid arthritis, fibromyalgia, chronic fatigue syndrome, and multiple sclerosis. Dryness can also occur for other reasons, such as side effects of medications. There is no single test that will confirm the diagnosis. There is no single test that will confer the diagnosis. We believe it's an autoimmune disease, say the MDs, that there is an antibody that the body has created which attacks its own body. The body has created an antibody which attacks a certain part of the body, as though an antibody that attacks the joints, an antibody that attacks the lacrimal glands, an antibody that attacks the salivary glands, an antibody that attacks whatever, right? An autoantibody. However, only about 70% of Sjogren's patients have the antibody. What? You just told me it was an autoimmune disease. So if only 70% of the people who have Sjogren's disease have the antibody, how can it be an autoimmune disease? What about those other 30%? They either have Sjogren's or they don't have Sjogren's. So if they do have Sjogren's, if they have all of the symptoms of Sjogren's, but no antibody, then it can't be an autoimmune disease. It can't be. It cannot be. You can't play it both ways. But the MDs do all of the time. Oh, and by the way, Sjogren's symptoms overlap or mimic those of other diseases. So, MDs are jumping into the waters of complex, unbelievably sophisticated, complex, metabolic stuff happening every millisecond of every day in the human body in a holistic fashion. Everything's connected. Everything's orchestrated by the unseen intelligence of the body. And when certain things start to go wrong with a certain subset of the body, the MDs focus on that and they say, oh, that's lupus. Oh, that's rheumatoid arthritis. Oh, that's fibromyalgia. Oh, that's chronic fatigue. Oh, that's multiple sclerosis. Oh, maybe not. Because between all of these illnesses which the MDs have pigeonholed and categorized, there is tons of gray area, tons of overlapping, which supports the holistic notion that there is no such thing as fibromyalgia, no such thing as rheumatoid arthritis, no such thing as lupus, etc., etc., etc. Because if there was something this specific, it would show up exactly the same way in everybody that got it every single solitary time, but it does not. I could have 100 rheumatoid arthritis patients, all with definitive diagnoses of rheumatoid arthritis by the top rheumatologist in the world, and all 100 of them would have dramatically different symptoms. They would have dramatically different presentations of the illness. This person's rheumatoid arthritis might be in the right knee. It might be in the left knee. It might feel better from motion. It might feel worse from motion. It might feel better from heat. It might feel worse from heat. They might be able to predict a rainstorm 10 times worse when it starts to rain, or 10 times better when it starts to rain. This person's rheumatoid arthritis might be associated with migraine headaches. This person's rheumatoid arthritis might be associated with pain in the muscles. This person's rheumatoid arthritis might be associated with memory loss, dry eyes, or dry mouth, etc., 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 etc. But the MDs do not pay attention to the distinctions brought forth by a living, breathing, holistic human body inhabited by the soul. The MD's point of view is old-fashioned, outdated. They're looking at a three-dimensional picture two-dimensionally. They're like colorblind art critics who don't know they're colorblind. They're missing gigantic pieces of data, and therefore their conclusions must be wrong. Wait a minute, Sjogren's syndrome, I thought you told me it's an autoimmune disease. Now you're telling me that 30% of the patients who have Sjogren's don't have the antibody. So what the heck? You can't have it both ways, but the MDs always do. They always do. Which is why a rational person, a person who's smart enough to pass the driver's license test, would be able to see through this nonsense if they looked at it. The problem is that because we've all been fluoridated to death for the last 100 years, everybody's IQ in this country is just a little bit bigger than that of a chipmunk. And everybody thinks that the MD is a million times smarter than they are, but they're not. Someone told the MD that it's an autoimmune disease, and they believed it. And now since all of their colleagues believe it, it becomes reality by consensus. Can somebody please tell me the mechanism through which the body creates an antibody against itself and starts to destroy itself? Does that make sense to you? Does that make sense to you? It doesn't make sense to you, but it makes perfect sense to the MD. Because the MD has come late to the party. And remember, the MD's point of view is that your body is a biochemical accident. Your body was an evolutionary fiat that happened thousands of years ago from a coincidental amalgamation of biochemicals in a Jurassic swamp, stimulated by a bolt of electricity from a passing thunderhead, and then the first cell was born. What? That's what the MD believes. And then life evolved. Over the course of billions of years, we crawled out of the swamp, and now we're human beings. You got to be freaking kidding me. The MDs believe that your body is an evolutionary happenstance. It's a coincidental combination of biochemicals, and because it's a happenstance, everything goes wrong with the body all of the time. So when things go wrong with the body, that's just life, according to the MD, because they believe that once you're sick, you're screwed and you can't fix it. And it is the inherent nature of the body to break and for things to go wrong. So they'll see somebody with arthritic pain and dry eyes and dry mouth, and they see an antibody in the blood that they don't see in someone who's healthy, someone who doesn't have these symptoms. And so therefore they conclude that it's the antibody that's causing these diseases. And it is not. The antibody is a result of the disease. When there is chronic inflammation, because you're consistently eating all of the wrong foods, and your body does not have the raw materials it needs to put out the fire of the inflammation and then fix the tissue that was damaged, you get diseased and decayed tissue building up in your body. Inflamed, diseased tissue building up in the body. Now remember, your body is smart. Your body has wisdom. So your body hires a house cleaner to come on in and clean up shop. Your body creates an antibody to chew up the old, dead, diseased tissue. The MD looks at that and thinks that's what causes the disease. We look at it and know that it's the result of the disease. Ladies and gentlemen, your MD brings to the table an old-fashioned, outdated, archaic way of looking at disease and health, and you should fire them as fast as is humanly possible. I'm Dr. Peter Glidden, by the way. This is Fire Your MD Now. Stick around. Welcome back, everybody. Dr. Peter Glidden here with you. November 20th, 2013. See, the problem is that nobody questions the MD. The MD doesn't even question the MD. The MD just believes what they're trained and told in school, and then everybody goes along for the ride. And this is why their therapeutics and their determinations are built on shifting sand. So when I was in medical school, they had their recommendations for the upper end of normal for blood pressure was a certain number, and then they changed it 2 times before I graduated. They changed it twice. They did the same with cholesterol. They change it all the time. Now they're changing their recommendations about PSA, and everybody gives them a pass. See, their therapeutics, their understanding of the way that the body works is incorrect. They're exactly like colorblind art critics who do not know they're colorblind. They're seeing some things correctly. They're seeing some things correctly. They see that there's an antibody there. They see that there's a set of symptoms which is consistent more or less from patient to patient, gross, overt symptoms. They don't pay any attention to the subtle symptoms. And that's where it ends, and then so they make a determination, oh, this is Sjogren's. But where's the autoantibody? Oh, we don't know. It's nonsense. It's nonsense. But they don't know that it's nonsense, and they think they're the bee's knees. They think that if they weren't taught it in medical school, then it just isn't valid. They think that they practice medicine. They don't even know. Most MDs are not even aware or cognizant of the distinction that they're trained in allopathic medicine, because it's not pitched to them in medical school as allopathic medicine. It's pitched to them as medicine. Most MDs don't even know what allopathic means. They think that they are trained in medicine and everybody else is trained in alternative medicine. Right? This is the arrogance of the profession. You know, that's like saying the only dog that's a dog is a German Shepherd and every other dog is an alternative dog. Well, that's nonsense. That's like saying the only race that's the real race is the Germans and everybody else says, oh, well, we've already been down that road, haven't we? See, this is the thing. You don't know what you don't know, and the stuff that you didn't, so far outside of your wheelhouse that you didn't know it is going to kill you when it comes to medicine. your MD's point of view is going to kill you when it comes to medical treatment. It is. Their color blindness, so to speak, often doesn't get in the way when they treat trauma, because there's only so many things necessary to do to sew up a bleeding artery. It's a pretty straightforward process. The sterile technique is a pretty straightforward process. There's only so much that's necessary in order to set a bone and make sure that it's secure while it heals. You can dial in anesthesia more or less with, I'm not going to say relative ease, but it's a stepwise process that is extremely well suited to the reductionistic mind. But chronic disease treatment, even just chronic, the understanding of the genesis of chronic disease is beyond the ken of the MD, because they're blind to most of the stuff that's going on, and they don't even know it. And this is a gigantic problem. So when someone has Sjogren's syndrome, what do we recommend to support and promote the structure and function of the body? Number one, you have to stop eating foods that cause inflammation. So you have to eliminate the 10 bad foods. No whining, no complaining. Just shut up and stop eating the 10 bad foods. Number one. Number two, you must give your body 100,000 ORAC points of antioxidants a day. 100,000 ORAC points or more of antioxidants a day, and you can do that with a combination of nutritional supplements and food. Number three, the recommendation for nutritional support, because you have to fill your body's nutritional tank up to give it the raw materials it needs in order to work optimally and put the fires of inflammation out and repair tissue that's repairable. The recommendation there is 1 anti-aging healthy start pack, 2 bottles of selenium, and 1 bottle of plant-derived minerals per 100 pounds of body weight per month. That's 1 anti-aging healthy start pack, 2 bottles of selenium, and 1 bottle of plant minerals per 100 pounds of body weight per month. Secret sauce here, of course, would be 1 Ultimate Daily capsules, 1 bottle of Ultimate Daily capsules per 200 pounds of body weight per month, and as much Z-Radical or Fucoid Z as you can afford. After you've done this program for 3 months, a detox is a good idea with some colonics, and then you're on the road to recovery. Because why? Because you've given your body the stuff it needs to fix itself, and you have stopped consistently eating stuff that hurts itself. Going to Rudy in Michigan when we come back. Stick around. Hey. From the proper perspective, everything makes sense. Too bad. The MDs, when it comes to chronic disease, are looking at it from absolutely, positively the wrong angle. Let's go to Michigan now, talk to Rudy, see what's up. Hey, Rudy, thanks for the phone call. You are live.
Hi, Dr. Glidden. Thank you for taking my call.
You're welcome.
Let's see. I went to a wedding about 6 weeks ago, saw a cousin of mine. Hadn't seen her in a while, noticed she was walking with a cane. So I told her I would see if I can help her out, if she'd be willing, and so I sent her some OsteoFX and some glucogel, and I sent her your webinar on arthritis and rheumatoid arthritis. And she called back thanking me for the products, that she was going to start taking it. She says, maybe you can help my husband out. He's 61 years old. He has liver damage and severe water retention. They drained him once, and the water keeps coming back. He also has type 2 diabetes. She described it as skinny legs, and everywhere else is bloated. He's in a convalescent home right now, and she's upset because she goes, and it's all because of the medications he's been taking that screwed up his liver. And I says, you're probably right. And so I was just wondering how we can help the man out.
Well, it's difficult now because he's in a nursing home, and when someone's in a nursing home, often it's a fight to get them to give him supplements, and that's what's necessary here. So, and this is part of the problem, right? Because people come to us at the end of the line. They come to us after they've had 50, 60, 70, 80, 90 years of trouble, and 90 years of bad diagnoses and 90 years of bad diet and 90 years of bad food, and then they expect us to do some heroic thing in the last minute of the 9th hour and snatch them off the train tracks before they get run over. So when I see things like this, Rudy, what it makes me do is double down on my own discipline. When I see things like this, what it makes me do is get on fire to talk to people about this when they're in their 30s and their 40s and their 50s, before the train wreck has happened. When I see things like this, it motivates me to pitch the message of health recovery through science-based, clinically verified medical nutrition to as many people as is humanly possible, as rapidly as is humanly possible. Because, you know, I don't know how much we can do for this guy, because holy smokes, man. And number one, he's in a nursing home. Number two, it's got all this stuff. And number three, oh my God. So, you know, now look, we are the souls of pragmatism here. And honest to God, since I've been working with Dr. Wallach, I have no idea at all where the point of no return is. I've seen people come out of comas with medical nutrition under Dr. Wallach's supervision. I've seen remarkable things happen. So, you know, it's entirely possible that there's room for improvement here. Nobody knows, and it's worth a college try, so to speak, really, but I'm not hoping for the best here. But notwithstanding that, the recommendation would be the healthy blood sugar pack, selenium, and plant-derived minerals appropriate for body weight for the first 90 days. But no, I'm going to change it. No, yeah, the healthy blood sugar pack, the plant minerals, and selenium appropriate for body weight for the first 90 days, plus completely eliminate the 10 bad foods. That's where I would start. Now, if they balk at giving him all of that because they're knuckleheads and they're in the, the nursing home and they just can't be bothered with all of this stuff, then just give him selenium and the plant-derived minerals. Give him the selenium and the plant-derived minerals. Give him, 4 ounces of plant-derived minerals a day. 4 ounces of plant-derived minerals a day, and the recommendation for selenium, of course, is 3 capsules per 50 pounds of body weight per day. 3 caps per 50 pounds per day. I know they could do that in the nursing home. They might balk at giving him, the full Healthy Start pack and, the extra plant minerals or whatever. But you got to start somewhere, man. And it'll be interesting, from a purely objective, unemotional doctor point of view. It will be interesting to me to see what happens to this guy, even if we do give him a minimalistic treatment, because one of the reasons that drugs create side effects is because all drugs work by virtue of vitamins, minerals, amino acids, and essential fatty acids. That's how they work. Drugs don't have some magical esoteric influence in the body. Drugs stimulate up or down or stimulate or depress the inherent biochemistry of the body, and the inherent biochemistry of the body is all nutrients. So when you're on a drug for an extended period of time, and it depends on the drug and depends on the dose, the drug burns right through your nutrient reserves, of which you didn't have any to begin with. This is one of the reasons why drugs stop working, and then they need to increase the dose, or they need to switch it out to a different drug, because you've burned through all the nutrients that drug needed to work. Now you're running on empty and the drug doesn't work anymore. In a perfect world, the pharmaceutical industry would put the requisite nutrients in the capsule with the drug to increase the effectiveness of the drug, but if they did that, they'd sell less drugs. So they don't do that. They don't give a crap about health. They don't. They care about making money and about getting people to take as many drugs as is humanly possible before they die, which is evidenced by this guy's experience of his relationship with his medical professionals. I mean, you put yourself in his shoes, right?
Oh, yeah, and his wife is angry, and she has no knowledge at all of medical nutrition, just getting her feet wet, obviously, and she knows that they've hurt him more than helped him.
Well, the leading cause of death in the United States is MD-directed medical therapeutics.
Yeah.
The leading cause of death. So she's not alone, and she should be angry. But, you know, that and 25 cents won't even get you a cup of coffee now because it doesn't make a difference because the medical industry is so huge. I mean, 500,000 people were killed from one drug, Vioxx. 500,000 people. That's 500,000. That's probably, you know, let's multiply that by 3 for relatives, right? Brother and sister and mother, right? 3 people. So what's that? 1.5 million. 1.5 million angry people. 1.5 million angry people. And nothing happened. Nothing happened. It's not going to change. So our recommendation is, you know, longevity. And that one way to channel your frustration, certainly it works for me, one way to channel your frustration and channel your anger in a way that actually is going to make a difference, because you'll never win a fight with Big Pharma. You just won't. But one way to make a difference is to channel your anger and your frustration and into your longevity business and enroll like a rock star. Just talk to 10 people a day, right? So I could go on and on, Rudy. This is just a sad state of affairs, but it's everywhere all the time, and I guess that's kind of what gets you and me out of bed in the morning, right?
That's it. Well, I'll talk to her, and I'll give her this information, and we'll do the best we can and move forward.
All right, Rudy, good luck. Stay in touch and keep up the good work in Michigan. From Michigan to Georgia, we're going to talk to Kay about type 2 diabetes. Hello, Kay. Thanks for calling. You are live.
Hi, Dr. Glidden. How are you? And thank you for all that you do.
Well, you're welcome very much.
Yes. I have a guest on the line with me today. The guest that I'm going to be speaking about has been taking the Healthy Body Start Pack along with the selenium, and she just started on the, not the sweeties, she just started on the dailies. And her blood sugar count has gone up to 300. I'm not sure exactly what's going on, and I needed some help. And after that, I needed to ask you a question about H. pylori or H. pylori.
H. pylori?
Yeah, that's it. That's the next one.
Oh, yeah, okay. So, all right. So, well, we'll do that first because it's easy. H. pylori is a little bacteria that grows in your stomach, and it causes stomach ulcers. It causes stomach ulcers. The only reason H. pylori can grow in the stomach is because the stomach acid is weak. The stomach acid is weak. When the stomach acid is strong, the way that God and nature intended it to, the little bug can't grow there. Little bug can't grow there when the stomach acid is strong. So it's kind of a catch-22 because when you get ulcers in the stomach, the MD will put you on an antacid or a proton pump inhibitor so that the ulcer isn't aggravated by the acid in the stomach, and that makes more ulcers grow, and which is one more reason to fire your MD, because they just completely miss it. They don't get it at all, and they're dangerous, which is why they're the leading cause of death in the United States. So what we do when we're up against a definitively diagnosed H. pylori infection is support and promote the structure and function of the stomach, and we do that by salting our food religiously, by taking the Healthy Digestion Pack selenium appropriate for body weight, and 1 or 2 extra bottles of the white liquid calcium a month until it's gone. 1 or 2. You don't need to do killer biotic. You don't need to do colloidal silver. You don't need to do antimicrobials. You just need to strengthen the stomach acid appropriately, and when you do that, the stomach will kill the bug naturally, right? If it was the bug that was the problem, everybody in the world would have H. pylori. Because H. pylori is everywhere. I mean, it's everywhere. Bugs are everywhere. It's not the bug, it's the environment of the body which gives the bug a room to feed and breed. So that's how we do that. Now, with medical nutrition, I don't care what we're doing. I don't care if we're trying to optimize blood sugar metabolism. I don't care if we're trying to optimize heart function. I don't care if we're trying to optimize liver function or kidney function or whatever it is we're doing to support and promote the structure and function of the body. When it doesn't work, there's only 2 possibilities. You're either not taking enough or you're not absorbing what you're taking. That's it. Or, you haven't given enough time. But 90 days is time enough with a blood sugar issue to be able to get traction, a little bit of traction, a little bit of improvement on the blood sugar issue. So the recommendation for the Sweeties is 1 bottle of Sweeties per 100 pounds of body weight per month. Now, what you could do for 4 weeks is make sure you're taking the adequate amount of Sweeties. So right, if they're 200 pounds, then they need 2 bottles of Sweeties a month. But for 4 weeks, to kind of prime the pump and push it in our favor, take 1 extra bottle of Sweeties a month. So take the amount of Sweeties appropriate for body weight, and then 1 extra bottle just for 4 weeks, just for 1 month. And also selenium. Selenium and the essential fatty acids will augment the action of the Sweeties. So you must be doing the Healthy Start Pack, appropriate for body weight, because that has the EFAs in it. Selenium, appropriate for body weight. Sweeties, appropriate for body weight. And then what I would do for 4 weeks is add 1 extra bottle of Sweeties into the bargain. And the only other thing that can be at play here is we're either not taking enough or we're not absorbing enough. And the only thing that interferes with absorption is wheat, barley, rye, oats, oil in a bottle, fried food, yada, yada, yada. This person, Kay, has to stop eating the 10 bad foods. If they haven't done this program will take too long to kick in, or it just won't work at all. So clean the diet up, make sure they're taking adequate selenium, little extra Sweeties for 4 weeks. Give us a call back. I appreciate everything you do down there in Georgia. Stick around, folks. Going to go to Indiana, where I just was, and talk to Pamela when we come back. Hey, everybody. Sick and tired of being sick and tired? You're not alone, baby. Everybody in the world is, and that's why everybody in the world needs to call this show, 866-582-9933. Enroll, baby, enroll, and let's make Longevity Nation huge. I was just in Indianapolis a couple nights ago giving a lecture to the chosen few. Let's see what Pamela's going to talk about. Hey, Pamela, thanks for calling. You are live.
Hi, doctor. Thank you for taking my call. I appreciate it.
Yeah, how can I help?
I just heard about you, and my husband and I are getting up in age in our 40s, and we're sick and tired of going to the doctor. My husband has high blood pressure and just been diagnosed with type 1 diabetes. I've also
Type 1 diabetes?
Yes.
That's very unusual for someone his age. I think it's a wrong diagnosis. I think he has type 2. But but I don't know. Yeah, I would get a second opinion before I played another round of poker at that table.
Okay, we'll do that. Also, I'm having each year I seem to be getting migraines that are getting worse. Now they're telling me that I have TMJ. They're telling me that my bones and my gums are deteriorating, so I'm having a lot of gum problems. They gave me a root canal, and just my mouth is totally messed up. So we're trying to look for some all-natural ways now to just get rid of this. We're sick and tired of going to the doctor because it seems like we're continuing going more and more every year.
Well, see, this is it, right? I mean, you're absolutely right, and you've just hit the nail exactly on the head, because the MDs, and you wouldn't take a Chihuahua duck hunting, right? I mean, that's right. The wrong dog for the hunt. You're not going to get anything if you take a Chihuahua duck hunting.
Right.
Right? So the MD, bless their hearts, I mean, they might be really awesome human beings, right? They might work for Doctors Without Borders. They might feed the homeless, feed the hungry, house the homeless. I don't know. They might be awesome people in person. Mm-hmm. But professionally, they're not trained how to fix anything. They're only trained how to manage things with drugs. They don't think that your body can fix it. They don't think you can recover from TMJ. They don't think you can recover from migraine headaches. They don't think you can recover from high blood pressure. They think that, life stinks and then you die, and it's the doctor's job just to kind of clean up the debris while we get ready for the next round of destruction. And it's an insane point of view, and yet we give money to these people, every month in the form of insurance premiums that gives us access to their insanity. I mean, we need our heads examined as a culture, for goodness sake. Now, the most common cause of high blood pressure is a calcium and magnesium deficiency. There are other things that cause it, but for the first 90 days, when we're supporting and promoting someone's circulatory system who has a diagnosis of high blood pressure, we assume it's a mineral deficiency, and we give the body a lot of minerals, and we see what happens to the blood pressure. That's the most reasonable thing to do. Now, because of the blood sugar game which is afoot, whether it's type 1 or type 2 diabetes or something in the gray area in between, it's irrelevant, because our method of supporting healthy blood sugar metabolism in the body is the same regardless of the diagnosis. So how much does your husband weigh, Pamela?
Around 165.
All right. So my recommendation for him per month for 3 months would be 2 healthy blood sugar packs a month. 2 healthy blood sugar packs a month. And 1 bottle of something called Cal Toddy, C-A-L-T-O-D-D-Y, Cal Toddy. 1 bottle of Cal Toddy and 2 healthy blood sugar packs a month for 3 months. Okay. For you, migraine headaches, from our point of view, are a deficiency in a biochemical called a prostaglandin. And in order for your body to make prostaglandins, it needs essential fatty acids. It needs omega-3 and omega-6 essential fatty acids mostly. It needs a whole bunch of other nutrients as well. And this is the skill set that we bring to the table. We provide holistic nutritional support. We don't just give a lot of calcium or a lot of fish oil or a lot of vitamin D like the knucklehead MDs do. So the recommendation for you would be 1 healthy brain and heart pack and 2 bottles of selenium per 100 pounds of body weight per month. 1 healthy brain and heart pack and 2 bottles of selenium per 100 pounds of body weight per month. Plus, both you and your husband need to eliminate all 10 bad foods. And you can get that list for free just by visiting my website, fireyourmdnow.com. Click on the link to join my free newsletter, and life is good. Thanks for the call, Pamela. Second hour coming up, folks. Stick around.